Hi, and welcome to the Ask Dr. Angela podcast with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been too embarrassed or shy to ask your own doctor about your, girl parts? Well, you've come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. Obstetrics and gynecology? She keeps it real. Pregnancy? She's been there, done that. Menopause? She'll get you through. Young or old, Dr. Angela's got you covered, girl. Now here's Dr. Angela.
What's good, people? This is Dr. Angela, everyone's favorite OBGYN, and I would like to welcome you to episode 191 of the Ask Dr. Angela podcast. So I gotta tell you, as part of my routine visit with folks for annual, and it's just me sort of kind of getting to know you as a person, not just a patient, I'm always asking, what do you do for fun? What do you like to do? And I am increasingly finding that it takes folks a really long time to answer this, which leads me to believe that you need to focus on spending more time and investing more time in yourself. And as women who do everything, I know this is particularly hard. So oftentimes that is a challenge from me to women that I take care of or talk to. Do something fun and good for yourself, because the next time that I see you, I'm going to ask you, and hopefully it won't be such a chore or a task to answer it. So I'm sitting in my studio and I'm looking at my red electric guitar that's sitting in the corner looking at me, and it just makes me smile. I love playing my guitar and taking my weekly guitar lesson. I just learned a song by Johnny Cash not too long ago. It's called Hurt, and I think 9 Inch Nails did a cover of it. And certainly you know what I play is all over the place. It can be anything from Johnny Cash to Oasis to Maroon 5 to Corinne Bailey Rae, Stevie Wonder. I mean, the list goes on and on. It really just depends on how the music strikes me or makes me feel. Today's podcast really isn't so much a question, but it's a revelation. It's how I feel. And what I'm going to tell you is that cancer completely sucks. Cancer freaking sucks. And I'm saying that to you because for the past 2-3 weeks, I have been a complete cancer magnet. I can't tell you how many cases of cancer I've diagnosed in the past 3 weeks. And I mean, I don't feel good about this. I flipping hate having to tell someone that they have cancer. It's been anything from breast cancer to endometrial cancer to I even recently diagnosed a case of cervical cancer, and it wasn't even in what I would call the usual suspects. You know, cervical cancer, it's associated with HPV, folks that, have a lot of risk factors like promiscuity, cigarette smoking, no pap smear in eons. I mean, the woman that I recently diagnosed with cervical cancer is almost 90 years old. I mean, in what alternate reality does that happen? Notice I'm kind of hung up on this alternative word with all the recent events. But anyway, I guess what I want to say to you is know your bodies. Be in tune with your bodies. Look at your bodies. Feel your bodies. Cancer does not discriminate. Most cancer actually is sporadic. I mean, everyone gets so caught up in, oh my gosh, family history. And while family history is really important, a lot of cancer is completely sporadic. It's still, to this day, one of the hardest things that I have to do. And that's tell someone you have cancer. It just doesn't feel good, specifically when you have a relationship with the folks that you're taking care of, the women that you're taking care of. But, as G.I. Joe always says, and I quote this all the time, knowing is half the battle. And so knowing, we move forward and we kick cancer's ass. And so that's what we do. I need to get one of those t-shirts. Maybe someone can send me a t-shirt that says kick cancer's ass. So just, go to your doctors, have your annual checkups, look at your body, know your body, feel your body, touch your body. And if something doesn't look or feel right, please let your OBGYN or your physician know. I guess this is kind of an off, or shall we say non-traditional public service announcement for making sure that you're in tune with your own body. So that's today's podcast. As usual, thank you so much for the continued love and support. You guys are completely amazing, women and gentlemen, because we do have some gentlemen that follow our podcast. You are rock. You're completely amazing. If you have a question that you would like featured on the Ask Dr. Angela podcast, you know where to find me, www.askdrangela.com. That's AskDrangela.com. You can click on a button and email me, or you can access me through any of my social media venues. That's Facebook, Twitter, Instagram, and all of those are found on my webpage. Also, be sure to check out our YouTube channel where we're featuring short clips of me giving you hot topics and tips that I think you both need and want to know about. Also, remember, for those of you that are subscribers, come February, you are going to need to resubscribe to the podcast. We are making some technical changes to the Ask Dr. Angela podcast, so come February, you will need to resubscribe. In closing, let me leave you with this, and this is from Henry David Thoreau. In the long run, you hit only what you aim at. Therefore, though you should fail immediately, you had better aim at something high, because you know the sky's the limit. Until next time, look better, feel better, be better. Can't wait to reconnect on episode 192 of the Ask Dr. Angela podcast.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any disease or illness and does not and should not replace treatment from a medical professional.